This is my instructional video for the KIM test. It was developed in 2005, and it should be noted that the article that I'm going to speak about in terms of diagnostic accuracy and kind of how the test was developed was written by the person who also developed the test. So there is an aspect of bias when we're talking about this particular test. It was originally developed because the accuracy of MRI in diagnosing posterior inferior labral lesions is very low and oftentimes is only diagnosed correctly and accurately during surgery. The KIM test has also been adopted in clinical practice to aid clinicians in diagnosing posterior inferior instability. And why this is because patients, overhead athletes, volleyball, softball, gymnastics, if they do have posterior instability, it's likely that they also have labral fraying or detachment. As you can see in the video, a positive KIM test elicits a sharp pain during that axial loading at 45 degrees of upward adduction. And in a study, and again this study was done by KIM, all shoulders with posterior inferior instability demonstrated that clunk. So that should be noted as a positive test. In terms of diagnostic accuracy, the sensitivity of this test is 80%, the specificity 94%, a positive predicted value of 0.73, and a negative predictive value of 0.96. And the inner examiner reliability, and it should be noted that one of those examiners was the developer of the test, was 0.91. So while this test may be very diagnostically sound and has sound psychometric properties, the clinician should be wary in clinical practice and should use their clinical judgment as well as a cluster of tests in diagnosing.